Jessica DaMassa with WTF Health. I am here at HIMSS Health 2.0 Europe, and joining me right now, I have Pablo Prieto. He is with the Curelator, which to me is like the Terminator, but it's not. It's not. What it is it's an app, and it helps with people who have migraines. So tell me a little bit about this and what it is that makes you guys stand out.
Well, first of all, we're not here to terminate anybody. We're actually trying to help people. It's an app that it's a self-management module. People track their daily activities. Most people with migraine think that their daily activities impact their migraines. So we correlate both. We found interesting things that some of the factors actually protect you from migraine, some others trigger your migraines, and some others that you are usually avoiding, they have no association whatsoever. So we gathered out, we packaged that into little programs, and people take action on those factors, and we have clinical outcomes, basically.
Okay, so what are some of these factors that people are going to be having to pay attention to if they're going into the app?
So it's a 90-day program.
Okay.
So you need to be committed to finding out things that may be against your beliefs.
Like what?
Well, like a lot of people would say, onion is my trigger or alcohol is my trigger, and our statistical analysis will find out that no, it's not.
So what's it asking me to help kind of discern what my trigger really is? Like what kinds of questions or what kinds of things do I have to track?
Oh, so it's just daily tracking. It's yes or no questions, and you know how you felt, how you slept, the activity, and so on, the weather. So it's 70 factors tracked under 3 minutes. So it's all very visual, very fast.
Okay.
Yeah.
And you track every single day?
Every single day for factors, only headaches when you have a headache, obviously.
Okay, so I was really impressed. You said you have really high adherence, and you really do. So tell me a little bit about your numbers. How many users and what's the adherence?
So we have over 10,000 users right now in our platform, both in the US and the UK. We're about to launch in Germany and a couple of other countries. And we have a freemium and a premium program. The freemium has a 65% retention rate on those 90 days. And the premium is 80%.
That's pretty good for the premium, right? Okay, and what's the percentage of people that are in premium versus freemium?
So we have 10% in premium.
Okay.
And the freemium includes clinician prescriptions through coupon system.
Very good, okay.
So if the clinician is involved, you get it for free.
So talk to me about the clinician and some of the things that they're getting out of this application. I mean, the data that they're getting and how useful it is to them.
So migraine is a pain condition, and that means that the pain that you feel is different than the pain that I feel. So everything is patient reported. There is no such thing like glucose where you tap it and you see what your glucose level is. And up until now, there were very few apps that could track outcomes, efficacy of drugs, disability. We do that for them. And it's the first time that they've ever seen this data. They're loving it. They were publishing tons with them. So it's all about the clinical advance of this.
So who are some of the partners that you're working with on the provider, on the pharmaceutical side?
Sure. So on the provider side, we are in the major healthcare centers in the US, Montefiore, Jefferson, Northwell, and so on. In Europe, we have Essen, Germany, the West Germany Center. We have King's College in London, and so on. And obviously, one of the hurdles for them is that they want to see their data in their electronic healthcare record systems.
Right.
So we're also working there.
Okay, great. So I want to ask about that a little bit, and I guess in a bigger question, because I feel like right now it's unusual to have a startup that is both in the U.S. and then also in Europe, and operating and working with clinicians on both sides of the pond, so to speak. So what's your advice, I guess, to others who want to get into this, where they've expanded outside of their native country and have taken their app overseas? What are some things that you have learned or some things that you could caution others to be aware of?
Ooh, that's a very tough question, Jessica. I would say that you need to plan and you need to know the specific locality. I mean, you need to have local language.
Okay. And so you've been very strategic in how you've entered. Did you come from the U.S. into Europe or the other way around?
So that's actually right. We were founded in the U.S., but we have offices here in Barcelona and also in London.
Do you need a local presence, you think?
I think so.
Yeah, that helps a lot? Okay.
Absolutely. I mean, think about the way we're going to try to monetize this. At the end of the day, it's a business. Everybody needs to make a little bit of money, right? So you're going to need the payers, you're going to need the clinicians. Every single paying system in Europe is different. In the U.S., it's even more segmented. So.
And that's one of the things, too, I just really quickly love your input on, as somebody who's doing both. How different, people always say, oh my God, the health system is so different in Europe. Oh my God, I don't know. Is it really that different where it's prohibitive, or do you think it's something that you can master if you do have someone maybe local who's helping you?
It's not that taxing if you have someone local that has the knowledge. Okay. Come on, this is a startup, so we're meant to be brave, right? And go and just do it. So find someone who can help you and do it.
Very cool. So if anybody wants to find out more about the application, it's Curelator, right? That's you want to spell it for everyone so they can find it?
Yeah, Curelator.
All these, yes, exactly. All these different applications, I always want to make sure you get your spelling in there because sometimes they're not exactly as they seem they would be. All right, well, thank you so much for joining us. It was a pleasure to speak with you. Thank you also for your extra insight. It's helping our startups out there come on over to give you some competition, but not in the migraine space.
That's it.
We don't want to give you a headache. Oh, no problem. Thanks for talking to us. This is Jessica DaMassa with WTF Health.